Hi there, Dr. Keaten from Mainely Veterinary Dentistry, and today I wanted to talk a bit about recognizing fractured carnassials in our canine patients. This is a really common problem that we see on oral exam here because unfortunately a lot of people think that antlers and bones and hard things are good for dogs to chew on, but unfortunately it also breaks teeth. It removes tartar, but it removes enamel and tooth with it. So it's really common for us to see broken carnassials on oral exam. And sometimes it can be hard to recognize because after the tooth is fractured, tartar can build up on that tooth to hide the fracture. So one way to kind of recognize this is one, making sure we're doing a full oral exam on all of our patients because that carnassial tooth is pretty far back in the mouth. So we need to really pull those cheeks back. And if you need to utilize the owner to help you do that, go for it. But, bringing that cheek all the way back to the carnassial because it's so common that this tooth is broken, but also just recognizing what the normal shape of the tooth looks like. So this is a model. So this is, perfectly healthy carnassial. This is what it looks like. And so when there's a slab fracture, it can also often change the shape of this tooth. So becoming familiar with what this tooth looks like, even looking for little chip fractures off the bottom, because if the enamel is missing, the dentin is exposed and infection can still get into that tooth even if the pulp is not exposed. So even little tiny fractures, we can bond those here to protect the tooth from becoming infected. So just encouraging, those full oral exams on every canine patient, really checking out those carnassials and being familiar with what it looks like. So this is the normal shape of a carnassial. Become familiar with it. We have lots more videos on our website at mainlyvetdentistry.com.